For more on the efforts in flattening the curve, Professor Obinna Onwujekwe is a member, Ministerial Expert Advisory Committee COVID-19, several other committees as well, research, and this is all for solutions to the pandemic. He joins us via Skype from Nsukka. Thank you for joining us on the program. I'd like to begin by asking that when you look at the curve of COVID-19 in the country, are we headed in the right direction to flattening that curve? And this is with the interventions that we've put in place so far.
Well, thank you. We are not yet heading in the right direction. The curve is still going up, despite what we've done. So what we've done is not flattening the curve. So it's still going up. And so that's the situation right now. So we need to do more, both by citizens and by the government and its partners. That the curve is not showing any sign of flattening right now.
So is it a matter of things that we're not getting right, or we don't have the right data and science that is, of course, guiding our interventions?
Yes, maybe we were not very prepared for the pandemic, at the time it started. And then, the political nature of Nigeria, where states are doing their things, the federal government is doing their thing. So that has also brought some problems, to the fight against COVID. But I think we are beginning to see things, interventions step up. But we've not gotten to that level where we think we can say, well, we are doing quite well and everything will flatten. For instance, we expected that the opportunity of COVID, that the health system will be strengthening, especially water and sanitation at primary healthcare level, but it's not happening. So things that we need to put in place for systems building, both in schools, primary schools, secondary schools, and in our health institutions are not happening. So, and then the citizens also, there's a lot of doubt again. So people are not doing what they should do. Lack of social distancing. So we are not there, until that awareness comes on both the citizen side and the government, really starts doing more. Then I think we are still a long way to go before we start seeing the flattening of the curve in Nigeria.
So as a member of the Ministerial Expert Advisory Committee on COVID-19, how much have, what's been the biggest challenge in terms of the duties of the committee?
Well, first of all, the committee is advisory. So we look at evidence around, we look at what is happening, we look at what the ministry wants, and then we advise on what should be done. But I think one of the biggest challenges we are not doing enough testing in Nigeria. The testing is very low. It's not, some states they've not even tested up to 1,000 people. So, and if you don't detect, we cannot isolate and treat. So I think the issue of testing is very is critical. And then the lack of personal or personal PPE, personal protection. Yeah, in our hospitals, in our primary healthcare centers. When you go to primary healthcare centers, where people that interact with people, you'll be shocked. In most of them, they don't even have any PPE. They've not even heard about PPE. So I think we need to get, see this fight against COVID as a systems thing, build a system. But I think the current approach of an ad hoc thing is part of the problem we're having. So things are not being done systematically in a way that build up a system to be able to respond adequately to the pandemic.
I also expect that those are also part of the recommendations you're giving, but in terms of the body language of those receiving it and then putting it into some of the interventions, do you think that they're listening?
Well, I think they're listening. And then we sincerely hope that the advice we're giving advice on so many areas, not just testing, including treatment, including on research, including on vaccines. We hope those advice will be implemented, at least if not all of them, most of them, and that will really help the country to flatten the curve and to win this war against COVID-19.
Finally, are there certain areas you feel we need to engage more people and especially the community, seeing as we are experiencing community transmission in terms of more education, awareness to flattening the pandemic?
That is very, very important. I mean, many Nigerians still do not believe there's COVID. They're still living life as usual. If you go to the market, you'll be shocked. People are not washing hands. People are not maintaining physical distancing. So we need to do a lot more in finding more relevant way of communicating to the people so that they know that COVID is real and then it destroys. Until that, so that awareness needs to be built up. It's not yet there. We need to come. People are still not convinced. Even at government level, I'm sure you know all the story. So a lot needs to be done. We need to engage a lot of civil society organizations, engage the religious groups, just as was done in the case of polio, to get people to understand and accept that the COVID is real. But I think it needs to build a broad-based coalition at the grassroots level. That is what we're doing. It's not what will happen with text messages, but it's what will happen with actual interaction by community-based organizations, religious bodies, people that they trust, because there's also a question of trust. Who do they trust? If people do not trust government, they will not listen to government. But if they trust religious leaders and their community groups and leaders, they will listen to them. So let's get to people that the people trust and use them to send information and convince them that COVID is real. Until they don't have to wait until then. Thank you very much.
Thank you so much, Professor Obinna Onwujekwe, a member, Ministerial Expert Advisory Committee on COVID-19. Thank you for joining us.
Thanks for having me.